And it looks like we are live. We are live. So you should be able to see me come up.
Okay.
On my page now. You should be able to see it. Move this over here. Read that out in a minute.
Oh, yes. Mm-hmm. All right. And then you said touch like share it.
Mm-hmm.
And
Right. And then we'll go over here. Let's get all of this mechanical stuff done out the way.
okay. And let me try to say touch like share it.
Mm-hmm. There we go. Let me see here. And I can see there's 3 people, but it may just be us. If anybody is there, please comment so we can see who is there. Post a comment here. So it's got me on my Oscar Coco page. All right, got my.
Let me turn this down.
Mm-hmm.
Hey, sister.
She came on.
Yeah.
Hi, Tank. What's up, girl? What's up?
She goes by Tati. Tati.
Oh, Tati. Okay, excuse me. Using the old nicknames. Okay. Oh.
Dang. Always.
So she just had another baby, right?
She had twins.
Oh, yeah, that's right. Look, Mara said 2 twins.
Mm-hmm.
Oh my goodness. We didn't see that one coming. It's a boy and a girl, right?
Yeah, a boy and a girl. Mm-hmm.
She got her boy. Aw. That's gonna be some fun there. That's gonna be some real fun.
Yeah. All right,
Let's see here. You know, normally go right at 8:05. Just give folks some time to come in and stuff like that.
Okay.
All right. I see there are 4 people in. Say hi so we can see who's here. Mara saying hi to you guys. Oh, hi, Kim. Welcome in, Kim. Welcome in. So I'm going to go ahead and get started, but I first want to introduce Tiara / Bonnie. I know about Tiara, but Bonnie, and then my beautiful friend Amara. Say hi, Amara. There we go.
Hey, y'all. Hey.
So I have known these beautiful ladies for a long time. I think you were a teenager, Tiara. Woo!
I know. 15 when I like 15.
Yeah, long time ago. And so you did this beautiful thing for your mom for the Mom's Day tribute that I did last week. And so I wanted to read it again because it was oh gosh, it brought me to tears, child. It brought me to tears. I had to get myself together.
No.
So I'm going to go ahead and read that. We did some Mother's Day tributes last week, guys. And ladies, and some guys, they sent in these pictures of their mom. And hey, Veronica. Hey, Kishana. And I was able to do a shout out for their moms. So this was Tiara's to her moms. I'm going to read it again. And she says, Mommy, I truly believe our souls chose each other long before this life. And being here with you, caring for you, loving you, it all feels written. You are strong in ways that go beyond what the world can see. And it's an honor to walk beside you through it all. And if there were another lifetime, I would find you again and choose you again. I love you endlessly. That thing. Yes, yes, yes. Isn't it just, that thing. Woo!
That's some
beautiful. It's so beautiful. I love it. I love it.
Yes.
I'm gonna make sure I send you the everybody who submitted their stuff. I'm gonna make sure I send it out to you guys. So this episode is a real special episode, guys, because us children, we do come on to the realization that one day that we may have to, care for our parents, our elderly parents, or if our parents end up ill. Some of us, we do not have a plan, and life happens and we don't see it coming. But when it does come, we have to, just being able to, prepare for it. And so that's what Tiara and her mom are here. They're here to just talk about what it's like, share the joys, even some tears if they want, about this whole experience. So my sister is a caregiver. I know a woman who takes care of her husband. So it is like a job. It's literally like a job. Some people are working 2-3 jobs and they're still doing that because it's still like a job, and it takes a lot physically, emotionally, all of those things. So we're going to talk about that. So before we get too deep, Tiara, tell us about your mom. Like before this, like tell us about growing up, how your mom was, like all those type of things.
Okay, so my mom, she is from Brooklyn, New York, Puerto Rican. She grew up really rough. She grew up in the projects, so she was what I would call a hood rat. But she was definitely a loving mom. She was very strict, and she was like keeping it 100, but she always made sure that we were taken care of no matter what. And so as we grew up, I would say she kind of fell like into depression, and that's what kind of started to the health situation started to go downward. So once she got like kind of stuck in this depression, she her I would say drug of choice would be like food, right? Like food was her comfort, food was her thing, and she loved to cook. Oh my goodness, like
yes.
She was Chef Boyardee. Okay. And that was awesome. The problem was that she didn't really like to really eat a lot of healthy foods, So she ended up developing diabetes, and after developing diabetes, she developed this thing called gastroparesis, and the gastro was so crazy it would make her like throw up all day long, like just she was literally throwing up. So she was a heavy set lady. She lost like over 100 pounds like within like less than like a year or so after she developed like the gastroparesis. And she would try to continue to like work. It is so crazy because she used to work for American Diabetes Association. And when she found out that she got, that she had diabetes, she ended up getting laid off. And not because of the job per se, they were like laying off a few people, and she just was one of those people that got laid off. And then shortly after that, that's kind of when things started to spiral. So
I'm sure, Getting the diagnosis right
Mhm.
was a lot, and especially if you're already dealing with depression, you know what I mean? So any little thing can kind of just like continue piled on. So I remember when she got diagnosed with that, and I would come over there, and you was like, "Yeah, she can't," and she was like, "Yeah, I can't keep nothing down." So
Yeah.
is it slowing down? What is that exactly? Do you know the?
So basically, it's like almost like if the stomach becomes like paralyzed in a sense.
Okay. Mm-hmm.
Not pushing, like it's the food is not being able to be processed the way that it normally should be. And so also because still, with the diabetes and then with that gastroparesis issue, she still wasn't really eating healthy. So it just was kind of like really like just forcing that food that was not really good for her to come out. And so it was, and then it got to a point where it just where she couldn't really, she couldn't really hold down anything. So it was, yeah, it gotten real bad over the years though, because you know
Right.
this her diabetes diagnosis was about when I was like 16 years old.
Okay.
I'm 36 now, so that was like 16 years old. And over time is when, like with the gastroparesis and the diabetes together, is like over time it started to really get ramped up. And yeah, it caused continuously caused a lot of damage.
This was she. I remember, talking to her, and as she was going through these changes and she wasn't working. And I just remember, her needing to reach out for help, right? And she's not working, so then that means to me unemployment, we do what we gotta do to eat, you know what I mean, and stuff like that. And I remember she went to go get help from a office, and they were just so rude to her, and it just made me upset that, knowing for somebody who worked so hard all her life, and she took care of you guys. At one point she had your cousins, you know what I mean?
Yeah.
So I'm looking at this woman who has given so much of herself over the years, single mom, like she made it happen for you guys.
No,
She
she
opened her house to other people to come in, and she fed them. Look, she fed me. I'll never forget, she made these potato balls. I was like,
yeah,
Myra, I'm about to move in off these potato balls, you
yeah.
know?
That's something
So,
I definitely missed the most. And she was a very giving person. She always was looking out for people, always extending herself to house people. She definitely, had a good time at raising, my aunt's kids, you know what I'm saying? So yeah, she definitely took in a lot, and she
yeah,
always had a lot of weight on her shoulders, which is where the depression comes from, because
yeah,
our family is kind of crazy. And in the mix of that, she was always the one that everybody had to call on to for this, for that, for whatever the case.
right. The strong one. She was a strong one. People forget that you may be the strong one to everybody else, but you have your moments too. You know what I
Yeah,
mean?
yeah.
And we try to, those ones. I'm one of the ones that I think people think that I'm a strong one too. But it can be overwhelming sometimes trying to look out for everybody, being pulled this way, being pulled that way, and then if in a situation, where you fall out, I mean, you fall down, I should say, and get sick. You know what I mean? It's a lot because you're so used to being able to do these things and help other people, and now you're just in a different position, and you got to now put you first when you've always taken care of everybody else.
Yes,
You
yes.
know?
And nobody thinks about the strong one and what they go through, and the things that they have to deal with personally, right? Like at that time, nobody was really thinking about like depression and what it can do to physically to the body,
Yeah.
the mind. Like it literally manifests into illness and sickness dealing with depression, and even through her situation, I've even learned to make sure that I take time to worry about my well-being and my mental state and what I have to go through, because I watched her
Right.
even through depression still try to make sure that whoever came over can eat too, or if they needed something. I mean, even throughout her sickness, she still wanted to house people, and there was a time where she was like so angry and like this and that, and just kind of like, I'm tired of people, or I'm tired of, and I never understood that until now as an adult, where I could I literally understand why she grew an anger towards people, because when you give and nobody's giving you, even in your time of trouble, it hurts.
Yeah, because they're takers. A lot of people are takers, and they take advantage, and they don't appreciate you. And when you do stuff from your heart, you're not looking for like a give back, but sometimes it's like, well, dang, like,
yeah,
don't, it's like you feel like you're taken for granted, And so, I mean, and then you could add, you just said depression, even stress. I mean,
yes.
Losing your job and trying to like, she worked for, I mean, she's always worked, what I mean? So
yeah,
she worked, you said American Diabetes or something like that?
Yeah. We got towards the end, before like she had these major strokes, she still was trying to work. She couldn't keep the job because she kept throwing up at the job,
Right.
So crazy. Yeah. So yeah, it was
they should have been able to. I mean, now that I look, where we are now, and things are so different with even this administration, and I ain't gonna get too far deeper to that, because that's a whole another thing. It's a lot of people who they would have been able to telework, and they had, reasonable accommodations. Like back then, like that would have been a good thing, you know what I mean, to allow somebody. And it's like now, or even then, like when you fall, I feel like sometimes these people don't care. They just don't care. They care about the work being done. They don't care about anything else, And that just brings a lot of, pressure when you lose your job, So when she started getting worse, like, and she's had how many strokes does she have?
So she's had a total of about 6 strokes. She's had 2 major strokes and 4 minor strokes.
Okay.
She's also had about 2 seizures. And yeah, and
was that from because I don't have that. I'm not like educated on diabetes. Is it from the diabetes?
Yeah. So
okay.
Her first 2 strokes, that was definitely as a result of the sugar being extremely high, and not knowing, because of course at the time, she wasn't checking her blood sugar, and nor did she really, she obviously, when you come from the background that she came from, nobody is really telling you, hey, you need to be like taking this seriously, or you need to be like, there's no knowledge in that sense, per se. So she wasn't really taking like the diabetes testing. Like she wasn't testing it, she wasn't checking her blood pressure, she wasn't doing any of those things.
Right.
So throughout the diabetes, like that whole situation, even with the gastroparesis, and then the eating, she started to develop blood clots, and so it was basically a mixture of her sugar being extremely high, and then her having blood clots, which was another issue that had caused her initial strokes.
Okay. Wow. I remember, she was hospitalized. Was she hospitalized? She was hospitalized for the 2 major ones, right? Like, or all of them?
No, so she was pretty much hospitalized for all of them. Yeah.
Okay.
Anytime because after the 2 major ones, that's when everything started to change. And this happened in 2019.
Okay.
Yeah.
Right. COVID. Okay.
So and shortly before that, I wasn't living with her, and after that had happened, before that had happened, when she was having a hard time keeping a job because of the gastroparesis, I ended up coming to stay with her because I needed to help her pay her bills and stuff like that.
Right.
Shortly after that, that's when she had made the major strokes, and so that things like that's just when everything started to change, like as far as her ability to speak and her ability to like walk, even her temperament, which was like, she was like real angry, and she was always like very cussy, and you know what I'm saying.
Yeah, feisty. Yeah.
Yeah, very feisty, but she was funny, and it was still out of.
Right.
But this time it was different. So it was like, what is that, right? And so come to find out, it was because her sugar was still extremely high, and apparently that makes people angry. So
it alters your personality.
Yeah, exactly.
Wow. Did not know that. Okay.
Yeah.
So then they had to. How did they get that under control? Like, how did they? What did they do?
So I mean, as far as with the doctors, I mean, so basically what we started to do was we started managing the diabetes. We started to change her eating and everything. I started to getting into studying holistic medicine, because her following strokes were as a result of side effect of the blood thinners that she had to be on. And she was having like other issues as far as with like the medications, like the side effects were manifesting a lot quicker because her kidneys and her liver was damaged due to the damage from the diabetes, the gastroparesis, the what I mean, the blood.
Right.
And so when your kidneys and your liver is damaged, when you go to take medicine and their side effects is kidney and liver damage, the side effects just manifest in the body like way quicker. So the additional strokes that she had literally wasn't a result of the blood thinners that she was on and stuff. So we had to get into healthy eating and also holistic medicine and like really change everything, like extremely.
So when you said eat this, so did she have to learn how to walk and stuff again too?
Yeah, so we
had that part.
Therapy actually after every time that she has like a mini stroke or whatnot, because she's so fragile, it's like a very thin line between doing good and not doing good.
Yeah.
So she always has to do physical therapy, speech therapy all over again, even if it's the damage is not permanent.
Right.
Because she's so fragile, it's like 1 week in the hospital, it can take away the progress that we've made for a whole 2-3 months,
Right.
Add another week on there, that's a whole 3-4 months of progress that we have to redo again,
Right. Because I mean, then they're not home, they're not where they're comfortable. People come, I'm like, when my dad was in there, I'm like, when can he rest? Because they came in there every freaking 5 minutes. I swear, taking blood, checking this, checking that, even at night. Like, go away.
Are the worst.
They
literally are the worst. I mean, you literally have to learn how to talk to the doctors. You have to make sure that you're educated on the things that needs to be said. You have to be well-rounded in understanding the medications that they plan to give her and why. Because it's a business. The pharmaceutical companies, the medical company, it's a business, and so they making sure that they give the medicine is how they make their bread and butter. But that doesn't necessarily mean that that's good for you.
Right.
So
right.
Happens, you have to actually sit there and look at see what this is, what and so we literally had to go through all of that.
Yeah, because it's like, I mean, I know you said the liver and her kidneys and stuff, but then she has this stomach thing, and I cannot say it between these braces and my lips. It ain't gonna work.
Yeah.
Some words I just bypass. Okay, there's too much going on. Mm-hmm. But does that affect like how she digests the medicine too? Because it was like pills or fluid, like how?
So now throughout the journey, the gastroparesis went away.
Okay.
So did the diabetes actually. So we kind of started to reverse those things by like literally healthy eating, like changing her foods. She's on a very strict diet. She has to eat straight organic. She cannot eat like just whatever oils. Can only have like olive oil or avocado oils in her foods.
Okay.
She doesn't do a lot of meat. Every once in a while, we'll do a little bit of lamb or something, but consume meat. And so for the protein, of course, you'll do like I do a lot of chickpea mash. I make meat supplements with like jackfruit, or what is it called, artichoke hearts, and I cook it up, and then peas and vegetables and fruit. So she's on a very, very strict diet, which due to that we were able to pretty much the gastroparesis was non-existent anymore. But because of the strokes itself, it paralyzed the right side of her body completely. And so because of that part of the body is where you swallow, and that's also where it is it is where you get your speech from. So because of that, yes, like now all her foods, it has to be pureed because she chokes a lot. She also cannot how we naturally are swallowing all day long. She's not able to just do that. She has to think about, okay, I need to swallow. So we have to do a lot of repetition and practicing of her, swallowing and things like
because my dad had to go through something similar. I mean, he has dementia, so apparently dementia, I guess you forget how to swallow, or like, because I was like, why does he need a speech therapist? But the speech therapist, I guess whatever it is that they do, the exercises or whatever, they're going to make sure they swallow right, because what was happening with him is if he swallowed wrong, it could turn into pneumonia because it was getting down into his lungs.
Yes. And that's why it's so important to make sure that when she's eating, that she's actually swallowing, and you can tell when it's not going down right, because all the coughing and stuff like that. So that's when we have to do a lot of the speech therapies and things like that, just to make sure that she's actually swallowing properly.
Now I have a question for Myra. Myra, were you nice to the speech therapist? Were you nice to the people? You was.
Yeah, most of her speech therapy, one of them were like Puerto Rican, so they was all talking about New York and all that.
Okay, yeah.
She was like, most of her speech therapy people, were pretty cool, but that everybody doesn't get the sweetness all the time. If they, she's a little feisty, so
her days.
Somebody to finger real quick.
Not giving them a finger.
Yeah.
I thought you sent me a picture. I was like, is she putting her middle finger in the picture? I was like, Myra is wild. Oh gosh. Yeah, those pictures behind, I wanted, if you guys can see there behind, Tierra had those pictures made of her mom. They're absolutely beautiful. But Tierra, I'm just so proud of you, because mom needed you. It was like no second guessing. You just jumped right in, honey. You jumped right in and came to the rescue of your mom, and took care of her, moved in, and did all of that. And it's like, we all have our lives. Excuse me, I'm trying to act up. We all have our lives. We have things going on, but you were like, Mom, this woman took care of me, and I'm going to do what I have to do. And I just think that is so admirable, and it's like, you're like, no, I'm here. Because a lot of people, I think that they've had to place their parent in a home because it was a lot, and everybody, I mean, I'm not even down to anybody if that's something that they had to do, because that might have just been something that they had to do, And so, but you said, no, I'm going to come in and mom's just going to be with me, and I'm going to do that. And you're so knowledgeable, about her medicines, about her, what she has that is gone now. So we could tell that you're like a great, excellent caregiver, taking care of your mom. She always looks good. Let's see those nails, Myra. Myra was showing me her nails earlier. Look at that. Yes, honey. Yes. Got her nails done. Her hair is laid. Of course, we didn't talk about it yet, but Tierra does hair. And I know you probably do other things. You can share, that part too. So you do hair. So has that helped with you doing hair, help you be at home too?
Yeah. So and I used to do everything, but I specialize in just locks now. And I've been working from home for a while because I take care of my mom. So yeah, that's like, she's like my first, priority. And then of course I gotta get my money and work. I also do music on the side. And yeah, I'm an artist at heart. So yeah.
You can tell. Look at your hair. It's beautiful. Tiara likes the color. Oh, you guys, by the way, Tiara was my stylist for a long time with my hair, with my cornrows and all that stuff. You guys see them old pictures. Go ahead, honey. She took care of all of that. She also did my kids' hair. She was Skylar's girl. That Skylar will always go to and just end up just totally, totally, totally beautiful. So I already know that Myra is going to be beautiful every time. Yes, girl. Yes, show them your hair. Yes, yes. See that? So it's good to be able to have a caretaker that also knows how to do hair. So Amara has another daughter, Tati. I want to make sure I'm saying it right because I called her nickname earlier and I had to get corrected. So she's a mom. I want to say she has, it's 4 now, right? Yes, 4. Oh, 5. Oh my goodness. So apparently I have not been keeping up like I was. She just had a set of twins. So Myra is blessed to be a grandma as well. She gets them grandbabies. Now, how old are the kids? Of course, I don't know everybody's name. So
yes. So she has a 16-year-old, the firstborn.
Wait a minute, 16?
Yeah.
I did not realize her and Janae was that close in age. Oh my freaking gosh, Scott is 17.
Yeah.
Wow. Okay, go ahead.
In April. And then she has a 5-year-old, and her name is Soleil. And then she has a 1-year-old, which is Nova. And then she just had the twins, which is Zuri and Zayden.
So it is 5. Because I was like this, and Mara was like, 5. She's like this.
No, it's definitely
5. Mara said, get it right. Wow. Okay. Full house. So I know you guys enjoy the kids. I know the kids come over and make her day.
Yes, she loves when the kids come over or when we go over there. Yeah.
Yeah, yeah. Look at Myra say, So so did you have to okay, so we're taking care of mom, right? Did you have to do any updates to the apartment or to the house? Like, did you guys have to get somebody to come in and do all that stuff?
Everywhere we've lived, we've definitely had to make accommodations. She has a medical bed, she has a shower chair. She has the bathroom with the rails or whatnot. She even has a potty that's like next to her bed. Because like when we're coasting, like when I mean like coasting, which means it's like we're doing good for a little while. We still have to make sure that we have everything in place just in case that changes because things change. Right. So yeah, so we have all of those things. She has a rollator, which is what she uses to move around throughout the house.
Okay.
Has a walker, which right now we just kind of use that for the other side of the bathroom and in her little area. But then she also has wheelchairs for when we're going places and there's a lot of walking or whatnot.
Yeah.
Or if we just want to go out and I know that we're going to be doing a lot of walking around or whatever, and she just needs to be or we're going into an event or something and she needs to be sitting, she has a wheelchair for that. And I just got some new little stuff for her wheelchair. I always be trying to get her some good stuff. So
yeah, you're an artist too, like make it fancy, make it cute, and stuff like that too, Myra was always she was always girly and cute and all that other stuff herself anyway. So so on a day-to-day, so you up in the morning, what is your routine?
So our routine we first get up is right, it depends, right? Like, so right now in the coasting time, right?
Okay.
This is like not in a place where she just had, like, if she just had like another stroke or whatever in it, because it changes when stuff like that happens. But in a space of coasting like we're doing now, we get up, she gets up out of the bed herself, and she'll
Okay.
come sit on her chair or whatever. We do, her face wiping and stuff like that, and I prepare her breakfast. And so I bring her breakfast. She has like a little table and a tray. She has to wear a bib because she does makes a lot of math or whatnot.
Right.
And this is if this is like if it's not a shower day, because sometimes if it's a shower day, we'll do shower first. And so
Right.
if we're doing a shower day, I'm literally, taking off all her clothes, and then I put her in the shower and I literally wash her up, like bathe
Yeah.
her from head to toe. And then she'll come out, we'll sit down. She has this cute little robe that she be putting on. So she'll put her little robe, and I'll walk her to sit down. And she now is able to dry up herself and lotion up herself. And I set her clothes and stuff,
Yeah.
but I want her to put her stuff on. So
with her coasting, she has her independence still.
yeah,
Yeah,
like a great deal of it, per se. Some things, obviously she can't do, like, she always wants to brush her teeth. She tries,
Yeah.
but I have to brush her teeth for her because of the weakness from the strokes.
Right.
Right side, and she's not left-handed, she's right-handed. And so that right damage, she be trying though. She be really trying to get up in there. Like, she'll try her best. So she tries to do a lot of things like on her own. So but after breakfast, it's her time to do her exercising. And during
that's your favorite part, ain't it, Myra? The exercise? That's your favorite?
Yeah, right, exactly. She hates
no.
She'd rather sit here and watch Divorce Court all day long. That's her show right there, Divorce Court. And
which judge? Which judge is it?
Huh?
Which judge does she like on Divorce Court? Which one?
Judge Toller.
Oh, okay.
Oh, but Judge Lynn Toller is one of her favorites.
Yeah, mine too.
Yeah. She used to watch Kardashians all the time. That used to be her
show.
Watch them all multiple times now. So
yes, she not watching. Myra, you not watching the novellas?
Nah. I've been trying to put her on to different shows. Sometimes she'll watch a little something different, but she always go back to Divorce Court.
Oh, okay. Now I know, like with my dad, my sister has tried like I don't know, like maybe like cognitive things. Like does she still like read or color? Like does she try to do like some of that stuff? Yes.
So like that's a part of the activity, right? So like she'll do her walking, right? And she'll do like I have her walking in 30-minute sets. So she'll do a 30-minute set, put on a timer, and then she'll come, and when she sits back down, she's doing her books. So they're either crossword puzzles or they're like stroke related books. Like I can actually let me grab it.
Let's see.
Shadow, go home.
Shadow says she don't want you to share the books. Okay.
Stuff like this.
Okay. Look at that. Who knew that existed?
Yeah. There's a lot, and it's so good too, because like they have like stuff like this in it, know.
Wow, yeah.
Most of it, girl. And she gets graded, so
okay.
And she does good. She gets to have
good job.
Like one little jump treat that she can't wait to have.
Yeah. Okay.
Yeah.
You got a whole in school session going on over there.
Yeah. Yep. And then here's another one. The same things, just different puzzles. Each one has like different stuff in it. So and
that's really nice.
Yeah. Yep. So after that, it's about time for snack. So she'll get, her snack. And every time she eats, it takes her about an hour and some change, depending on what it is to eat. So
Okay.
that's a little bit of our time. So after her snack, she'll do more of her exercising, and then or we'll go outside for a walk. Like,
Yeah.
especially since the weather is getting warmer. She'll either go outside for her walk, but if we're not going outside, I have like a vibration plate. She'll get on that sometimes,
Okay.
like a workout or a workout video.
Okay. Oh, Myra, wait a minute. Myra, you know TikToks? You know, Myra doing TikToks, little workout videos.
Like YouTube has these little videos where they'll work you with using your rollator.
Okay.
So she'll do like a little rollator workout, and then after that, I'll leave her alone for a little while. So, because she'll get a little, depending on how sleepy she might get or whatever, she gets a little fussy, especially if I'm bothering her too much. Like, I'm always trying to keep her moving because it keeps blood pressure down,
Yeah. Yeah.
And right now she's not on any medications except natural supplements.
Okay.
So like a good one that she's on that's been very effective that keeps her from having blood clots is cayenne pepper supplements. That's
really
so
okay.
Good. That's also one of the good supplements that she takes. She also takes moringa seeds supplements. But one of her strokes were due to because of the damage from her previous strokes. It messed up one of the two of the arteries, the major arteries in her brain, cutting the ability of them by 50%. So they're like 50%. Yeah, they're working at like 50%. And so when they contract, it causes her to have a mini stroke, which is no long-term damage per se, but it's like, hey, the vessel is weak. It's, there's no blood coming through that.
Yeah.
They wanted to put her on like cholesterol medication. But the side effects of the cholesterol medication was causing her problems. So I took her off of that and I put her on the moringa seeds. And so that seemed to have been working really, really good. And
that's real interesting too, Tia, because I know like trying to do natural supplements, a lot of times the doctors, of course, like you said, it's a business. They try to do, a pushback, pushback on that, but I'm really happy that you like looked into it. Like, did you just like go to an herbalist? Like, how did you find out this information? Like, what to take?
Yeah, like honestly, so from 2019, from that moment when she started having, like, actually this was like in 2021 actually, or 2020 21 when I realized that it was the medication that caused the additional strokes. I had to figure out what could be done, what I'm saying, what can be done, because the doctors, they're just, literally we went through like 6 different blood thinners, and each of the blood started to give her strokes at a shorter amount of time. Like, almost even, I've even called her before she even had a stroke, where I just kind of felt like something was off, and like, no, we went to go get it. She had a blood clot in the lungs, before it could actually cause the actual stroke,
Right.
So they would try to up the dose of the blood thinners, and I would be like, okay, at that time, I'm gonna give it, thinking that I have to do this to make sure it helps, and so it got to a point where even aspirin caused her to have stroke. Like,
wow.
Yes, it was so crazy. And like I said, and it's because when the kidneys and the liver is damaged, right? Which a lot of the time when you have any type of illness or disease, your kidneys and your liver is the filtration system of the body. So of course it's going to have the most damage because it's doing work to move the toxins and the trash out. And so because of that situation, any type of medication which side effects are this or that affects the kidneys and the liver is going to cause severe damage. It's not going to be like for some people who aren't as fragile, they may be able, they may have a few years to take. So,
Right.
eventually you're going to have to care about your kidneys and your liver, but at least, with a more healthier body, you'll have a little more time. But my mom didn't have time. You know what I mean?
Yeah.
So I had to start studying holistic medicine. I literally had to just start going into herbal books and all types of stuff. I started watching people like Dr. Sebi,
Mm-hmm.
named Barbara O'Neill. I mean,
Okay.
start watching them and what they're doing, and just take it into into practice now. Like it's time to practice. So
Right.
down to like the cayenne pepper, learning about the fact that the cayenne pepper, it can never burn the stomach internally because it goes directly into the bloodstream, and it regulates that blood. It thins out that blood. No matter how much you take, it will never internally burn, because even though it will burn going down, if you take it like a spoonful of it, it's gonna be hot in your body, right? And that's why I give her the supplements so she doesn't have all that trouble,
Right.
stuff like that. But it will never internally burn you or your stomach, or like how some peppers cause ulcers and all types of things.
Yeah, I can't do spicy at all. Yeah.
Cayenne pepper does not do that because it goes directly into the bloodstream, and
Right.
that makes it so effective to keep as a replacement for a blood thinner. You can't take like cayenne pepper and your blood thinner together.
Right.
It's going to make your blood way too thin, and then that's just going to increase the risk of bruising and internal bleeding and all of that stuff. So it was a have to stop this and start this.
Got it. And I mean, look at her. Like I said, she looks good. I like the fact that you spoke about y'all get out the house, so she gets to do things. I like the fact that, I mean, because I follow you and stuff, I know that you get out, and get your time in too, which I think is important for the caretakers, because like I said, it's like two jobs into one. So it is good that you're able to be at home with her, too, but you still get to have a life as well. So what are the things that you also like to do outside of taking care of mom, which you do so great? What else do you do? You say you sing. I remember you was in a band at one time. I see your video. So like share like your passion.
Yeah, like I mean, I love music. I make like a sensual R&B music, and so I love to like do shows. I like to party whenever I can get a chance. I do have to make arrangements, as I call her like my toddler teenager. So, the teenager part, is like, wish her wanting to get her piercings done and her nails.
Yeah.
But the toddler part is where, I have to have like someone watching her when I do.
Right.
So I like, when I do step out, I like to make it worth my time. So I do like hosting for some parties and stuff like that. Some people will have like eye candy,
Right.
I like the nightlife. So,
Right.
Yeah.
Your mom ready for bed. Like, look, you just gotta make sure she while you're out. So
nighttime. Yeah.
Yeah. Myra, she be gone at night, huh?
Yeah. Sometimes now I still have to. My biggest thing is, because she is anything can happen at any point in time. So for me, I have like cameras all over the house, and I will prefer to have someone here.
Right.
If I do to decide to go somewhere. So I am a house, a homebody at heart. But when I do out, it's gonna be a reason, and then I'll make sure I have like the accommodations and stuff like that. Cause you good. What you got?
Do you get any you need a break? Oh,
No.
because we normally let go at 8:00. So I mean, I'm sorry, at 9:00. So I don't want to keep her over any time or whatever. If you guys got to go, just let me know. But yeah, so like family and stuff, I know you guys do little things, family come over and stuff like that. What are like some funny memories? Do you guys have, any recent stuff that made you laugh, that you guys laugh together about?
I mean, we laugh all the time.
Yeah,
Mom shaking her butt when we go outside, when we go out places. She loves to be, because her hair is like really, really long. You can't really tell right now because it's in a tight bun, but it's really, really like down her back.
Oh,
So
wow.
her hair, like, and shake her
You
little.
showing out. Mara, you out there in public showing out, shaking, you twerking. You twerking, Mara. Ain't too much change. Look.
Right. No, she likes to argue. So anytime people want to argue with her, she loves to argue and cuss you out. She gets a kick at that. So her and my best friend, they get together and they just be fussing each other and it'd be so funny. Yeah.
So some things have changed and some things have remained the same. Myra said, I'm still in here, y'all. I'm still in here. Mm-hmm. I'm gonna let you know. That's good. That's good. I'm so happy. I'm so happy to hear that. And that you guys anything else that you want to share? Like, what is this? I guess some advice that maybe that you can give the people who are watching, like, or even any resources that you suggest.
Yeah. I mean, I would say that, this job, this responsibility is not easy. We kind of make it look easier than what it is, because I really do try so hard to still give her a piece of herself before, but nevertheless, it's a change. You know what I'm saying? Like it's almost kind of like I still have my mom, but I'm like her mom now,
Yeah.
And it changes the dynamic very much. So, I mean,
right.
Very spoiled with her growing up,
Right.
I didn't cook, I didn't have to any type of paperwork. I never had to fill out paperwork. I never had to do any of that stuff. So when the roles reversed, I was like, oh, I gotta fill out the doctor paperwork. And so and all of that stuff. So I guess I would just say, like, for me, like I said, I would do this in another lifetime, but I wouldn't wish it on nobody,
Yeah.
Very tough thing. You have to be ready to choose other than yourself.
Yeah. Yeah.
Yeah, you have to be very, very mentally prepared to put the things that some of the things that you really want to do for yourself aside, because like for my mom, when things are going good, it's my opportunity to like chase my dreams and stuff like that. But when something happens, the dreams I'm chasing is put on. My life has to be put on hold. And it's love. It's genuinely love. And the fact that my mom, she broke her neck to take care of me and my sister.
Right.
Through it all, through her depression, through her trials and trauma, she really did the best that she could, and so for that, it's just something that I feel like I have I can't, I wouldn't see it no other way,
Right.
Imagine like my mom being in a nursing home or and don't get me wrong, sometimes I'd be ready to put her in a nursing home,
Mara laughing like, yeah, okay.
She be acting up. I'll be like, butter pecan. You know what I'm saying? But overall, I could never, because I know that they wouldn't take care of her the way that she needs to be taken. And my mom, she catered to me. She made sure I was dressed. She made sure I had, like, though we struggled, you know what I'm saying? We grew up rough, No matter what, she was always there for us,
Yeah.
And so, I would
you guys turned out great despite whatever you may, feel that was rough and all that other stuff. She did a good job. You guys, I mean, look at you. You're sitting here taking care of her, where other kids would have probably tossed their parents or something else. You know what I mean? So
yeah. I mean, it's definitely unconditional love, that she gave to me, and in return I give back to her. And just like, she served me as a child, and I'm serving her now. It's my time to serve. And I would say that this experience is very traumatizing. You have to be prepared for the worst. I've seen my mom die multiple times.
Oh my goodness.
Yeah.
Oh my gosh.
there's a lot of things that people don't know, because I'm not the type of person to be like, telling about all the things that we go through, or
Yeah. Yeah.
when when it's bad, I'm not the type to be like, oh, we're here at this place and that place, and I'm just starting to get more comfortable with sharing our lives with the world.
Right. Right. Right.
And I started doing like recordings, because we're about to put out, her little page to show, her life, right? Because
Yeah. Good idea. Yeah.
I mean, she's hilarious, and so
Always have been.
yeah, she's hilarious, and she's so feisty that it's so funny. So it's
Yeah.
show her life, and what also, and what it is that we go through, when
Mhm.
good and the bad.
Yes.
It's
Yes.
bad, it gets really bad, like, I mean, it's traumatizing. There's some things that she does, like even just with her facial expression, that will have me like, oh my God, like, and I have to
Right.
learn how to control my emotions, and how to deal with my, and actually seek help for my own mental stability.
Right. Right. It's a heavy load. It's an absolute heavy load, and just like any hospital stay, going there, like my sister, with my dad, like she's there. I forgot the name of the thing that she is, but she's like the caretaker. So she stays in the hospital room. She
Yeah,
makes sure she's with him every night. Dad was never left alone, because,
yeah,
like you said, like you want to make sure that they're being taken care of. And it's just been too many situations
you gotta watch.
where
You can
these
never
people
stop.
they're mistreating your loved one. If they don't see your face and they don't think you up there, God knows what could happen,
There has not one hospital visit where I haven't been there. I mean, I've literally I've lost out of weeks of work. And if it wasn't for my support system, like my sister, my best friend, my aunt, Millie,
Right,
my
right.
New York, and my ex, you know what I'm saying? Like,
Yeah,
watch my mom for me, or whatever the case may be. If it wasn't for my support system, it would be the hardest thing in the world to
yes.
do this job, because you need help. There's
Need
times
help.
a mental break. Even in the hospital itself, I can't leave my mom in that hospital for not 1 second. Now in Fairfax, they're a little more better, but they're still not where they need to be at for you to
Right.
be comfortable to say, okay, well, I could just go home. And so, no, you have to be
Yeah.
there.
Because there are other patients and stuff too, and they're not in there watching 24/7. And
Yeah.
then, it's like your mom really can't communicate. Like my dad can't talk at all,
Yeah.
So if something's wrong, are they going to be able to pick up on the signs or what's, you know what I mean?
Exactly.
And where what's happening. You're like, okay, so she's uncomfortable, something wrong.
Exactly.
They don't know her.
That little button, and I had to ask them multiple times, well, if she gives you this button and she presses it and she goes to talk and you can't understand her, then what? Like,
Right.
what are you? No, she literally has to be under surveillance, and you being there 24/7 with her, it could be a good thing or it can be a bad thing.
Right. Right.
Advantage of the fact that you're there,
Right.
and
Right.
then some points they just, good thing you was there,
Right.
times where I'm telling you, these hospitals, they do not care. And when you are taking care of someone, that's something that you have to understand. You cannot be a yes ma'am or yes man. You cannot just allow them to do whatever it is they want to do, because you have to remember that it's not about the best interest at heart. It's about it's the mic right here, but it's okay, mommy. It's not about the best interest at heart. You know what I mean? They don't
Right.
at heart.
Right.
So in the business, if they fix you, if they cure you, you're no longer a patient of theirs. That means you lost that business. They've lost the insurance money that you're bringing.
Right.
Especially if you have that good stuff, you know what I mean?
Mm-hmm.
They'll keep you in the hospital way longer. There's multiple times I had to fight to get my mom out of the hospital. I'm like, we can recover at home. And
look, they do a test, and the test will take 3 days. Why is the test taking so long? to come back. Like, come on now, you know.
It's terrible. It's terrible. And I've learned, which hospitals are the worst hospitals, which ones are the best hospital, which ones. I mean, you literally learn a lot of things, and it is traumatizing, and it is a heavy, heavy load. And so,
Yeah.
another thing that I would say, for people who are taking care of someone else, it is worth it. It's worth
Right.
it. But you do have to make sure that you have the help you need for your own mental health. You know,
Right.
because depression, can go either way. Like, you can get depressed. There's times where, I just feel overwhelmed.
Right. Right.
For example, like when my sister was going through her pregnancy, I couldn't lean on her as much when I needed a break,
Right.
because
Right.
had already gone through what she was going through. So sometimes, you have to be, you're gonna have to. It's a gamble regardless, right? Like, it's like
Right.
always you're always having to be the one to figure the things out. But at the end of the day, when you love somebody, you're willing to do what needs to be done.
Because
So
she did it for you. She did it for you. You were a child, and I mean, hey, you doing it for mom. Mom, you taking care of mom. Now,
yeah,
do you guys get like outside help at all? Like, I don't even know, like nurses or anything. I know the therapists and stuff come in, but any
yeah,
nurse help?
we get those all of those things if she has a situation. Like,
Okay.
we're coasting. I'm her main caregiver. So when we're coasting, it's not like, we need to do like a lot of the things. We can just gotta go to her doctor to get her checkups. I check her blood pressure. I've gotten her sugar and her diabetes under control. So I don't have to necessarily keep checking her sugar
Yeah.
and things like that. But every once in a while, I do, I check her temperature. I always have to check like her hands and her feet. So I pretty much do a lot of those things. But when we do have a situation, yes, we'll have like a nurse, or we'll have physical therapy, speech therapy, occupational therapy come. And
Okay.
I'm always very open to all of those resources, because
Yeah.
we'll do appointments, via on
Online and stuff. Okay. Yeah.
especially because depending on the situation, getting her out the house is a hard task. Like, especially if she's not mobile. Like,
Right. Right.
if she just had a mini stroke or something, it's harder to move her around. You know,
Mm-hmm.
yeah, like if she's not, one time, she wasn't even eating. Like, I literally
Right.
changed the diet to literally like broths and stuff to get her stomach
There to eat.
for
Yeah.
eating again. And then she started eating again. And I was, whoo, like, because it's scary.
Because if they're not eating, you're like, oh my gosh, you need to eat, you need to
Yeah,
drink, you need to.
yeah.
And then it's like I think about even how Myra may feel, because things change drastically for her too. And then here you are taking care of her. And I think that puts them through something too, having those roles reversed. And I know she's grateful, that you're there and that you're taking, but as a parent, you don't want your child to have to, take care of you. But then I think at the same time, it's like she probably wouldn't want anybody, else that
Yeah,
she loves and trusts and she knows is going to take care of her.
yeah,
She gets, that comfort in that. I know my dad, it was very difficult for him, especially I think even being a man, he used to take care of the family, the breadwinner, all of those things. And
yeah.
then now his daughter, and his daughters, I think he was a little resistant, and then like even having to like wash him, bathe them or whatever, and take, diaper, like all of that stuff. It's a lot, because
Yeah.
you're like, I'm the parent, and this is not something that I thought you was going to have to do for me. But the reality is that things in life happen, and we don't know, that could change everything. But I do want to say for my dad, because my dad is not mobile at all.
Yeah.
There's a service that the fire department does. It's called lift service, I believe. And you call
Mhm.
and you just say, hey, if he has a doctor's appointment or something like that, they'll come and actually take him out and take him to the car.
Yeah.
And you go to the, wherever you have to go, you come back and then you call them and then they'll come and take them back.
Yeah.
to the bed, you know. So
Mhm.
they do. I don't know if y'all in Woodbridge or Dell City or whatever. I don't know if they have that, but
Yeah, they have those services. I mean, if you have Medicaid, then especially for like the disabled, they have they have all types of resources and things like that. Especially
okay,
depending on whatever circumstances, like we've even had a little like a notebook or whatnot where we can call her doctors from and have like video calls, for the doctors and things like that.
okay. Because I know COVID. Like, what did you guys do with COVID? Did they come out or you remember?
COVID, I don't think like during the time of COVID, we were coasting for a while.
Okay,
Yeah, so
okay,
having another coasting episode. So kind of like from what I could remember, yeah, we were at a place where matter of fact, that was during the time where she had a feeding tube placed in her stomach. And
okay.
had to start because the feeding tube food was trashed, and so I had to start making my own. I actually found her this formula called Cake Farms, which is an organic vegan formula that was very helpful during that time, and it's like a meal replacement, and they have
Okay.
for like diabetics or if like just different stuff or whatnot. So
Yeah.
that for a little while, but yeah, her feeding tube has been removed since then. So yeah, during COVID, I believe that we were just in the house, honestly, and thank God, like we didn't have any crazy episodes during that
Right.
time.
Definitely didn't need no COVID mask going on top of everything else. So everybody that comes through to do their hair, they give mom her props and stuff. She gets to
Yes,
hang with you guys.
yeah, she's a celebrity here, at Bonnie Locks. So
You
yeah, they always
you Amara Kardashian in the house, huh? She
right. Yeah, she's definitely the star of the show. People come in, and her room is her door is like right here. The first thing that they see is like her photo, her pictures on the wall, and they always come to checking on her, how you doing, and all of that stuff. Yeah.
yeah, okay. Well, again, so she go out to get her nails done, or did
Yeah.
you do those? Oh,
No, we go out. We go out and get our nails done. Yeah. Mm-hmm.
okay.
Yeah.
Mara, it looks like you are in definitely good hands. You floss. So look at the shirt. What's the shirt say? Y'all matching. So I don't. Do you have a t-shirt thing, or is that your friend's business?
Yeah.
I see you.
This is the Heart
See it.
Gallery. My best friend, she goes by Navenchi now. I call her Nat, but this is the Heart Gallery T-shirt. So the heartgallery.co is her website, and she's also doing mood journals right now for mental health. And
Okay.
my mood journal too, because just writing, jotting down how I'm feeling for the day or whatnot. And so she's doing her mood journals, but she also still has her shirts and her clothing on the website, which is theheartgallery.co.
All right. I'm definitely, yeah, I seen, I think you guys had did a vendor event or something. I was like, oh, those are kind of nice. So yeah, I'm definitely gonna come through. If you get a chance, after this video, you're on your phone, tag it or write in with the gift gallery or her information. I think she's on my page though, but I don't know if she has like another page for the shirts.
Yeah,
So,
she has a website. It's called theheartgallery.co. I'll put it in the chat.
okay.
Site.
You got some nice stuff, guys. I've seen it. So it's really,
Yeah.
really nice. Listen, Tiara does locks. I'm sorry, not dreads. We're doing locks. She does locks. She's doing the singing thing. So definitely, guys, check her out. Myra coming out with some twerk videos. No, I'm joking. Myra laughs at everything I be saying. I be saying some crazy stuff. Myra got some videos that she's gonna be coming out. So definitely, Tiara, let me know about that because I definitely posted on my page and get her some folks, tuned in because I definitely want to see Miss Myra doing her thing. Listen, don't stop. She kept going. That's how she always was, though. She always was just a go getter, no matter what. And all this stuff that she's been through, and she's still sitting here. God is good. Myra, I love you guys. Tiara, thanks for coming on here. I'm going to send y'all that slide, that she wrote, which is so beautiful. Oh, I just loved it. So she said in any lifetime, she would still choose Myra as her mom, y'all. That's unconditional real love. Look at that. Y'all want to make me cry on this thing. That's so sweet. That's so sweet. So thank you guys. Thanks for coming. I definitely, Tiara, might have you come on a little later, show us some music and all that other stuff. I'm trying to do some other shows later on for talent. So definitely on my list, sis. You definitely on my list. So all right, Myra. Hopefully I can get my butt down there to Woodbridge. Everybody seem like they move so far away, so I can come through and see you and just hang out a little bit. So I miss hanging. Maybe Tiara can make me some potato balls. You know how to make that, Tiara?
Oh, chef. No. Auntie can do the cooking. She
know how to do it.
She can do the cooking. She be doing it. She got that same arm mommy had. So
yeah. Listen, I get it because that's what my sister got that. I do okay, but it is not like my mama was at all. I'm not even close.
I'm not good with
take care of everything else.
And that's about it.
Myra, is Tiara food good? I know she puree, and I hope she got some seasoning, something going in it. You get to season it a little bit, but you just got to be, careful with that.
Because I know, like, if it don't taste good, she won't eat it. So I have to make sure that it's like, got that good stuff in it. So I've learned a few things, and yeah.
Yeah, Serena said my dad will be like, yeah, he was done. I'm like, how do you know? She said I'm done. Okay, he let you start spitting like, I'm done. Don't give me that more stuff. Okay, you're done. I got you. So, but thanks, ladies. I'm gonna let you guys go. I'll definitely keep in touch. I'll definitely check out everything y'all got going on. All right.
All right. Thank you for having us.
Yeah, thank you for coming. Have a good night. Mwah. Myra, mwah.